All right, we are going to demonstrate how to access an implanted port. First, we would check our agency policies, making sure we have the appropriate kit, supplies, etc. We would check any orders. We want to make sure that, while we're in there, we're doing what we have to do. So whether that be blood samples or continuous infusion or anything else that may be prescribed while we're in there. And then we would assess the site. We're going to be checking for skin integrity, making sure that the skin around the port looks good, making sure there's no erythema, any excessive pain, swelling, anything like that. We want to make sure we gather our supplies. Also check labs. I'm going to check our patients' labs and stuff as well. We would gather our supplies, central line, dressing change kit. We want to make sure we have a bio patch if we're going to be dressing this and leaving it in. Huber needle. If we were to be drawing blood, then I would grab 3 flushes, making sure all the packaging and stuff is off and the air bubbles are out and everything is good to go before we get started. We would get heparin flush in the event that we are going to just be de-accessing right after we were to draw a blood sample or whatever the case may be. Then we would need heparin flush per our agency policy. We want to grab either scrub hubs or alcohol wipes. If our Huber needle didn't have a PosiFlow attached, then we would need a PosiFlow, or sometimes we need the extra PosiFlows to change in between blood draws, if that's what our policy is. So I do have an extra one of those if we were to need it. And then also for blood draws, we want to make sure we have that 10 ml syringe. We want to at least make sure we have that because that's this is what's going to give us the proper pressure to pull that blood out appropriately. So we've got all our supplies ready to go. So now we make sure we have that stuff. Then we are going to explain to our patient what we're going to be doing. They clearly probably already know the procedure by this point. They have this port and we're going to access that for whatever the case may be. Today we're going to draw some blood samples and we're going to hook you up to an infusion today. We want to make sure we identify our patient appropriately. So, Mr. Smith, could I get your name and date of birth, please? Thank you. Assess for any allergies, things like that. And it seems like we're good to go. So we would do some hand hygiene here. And also make sure we grabbed an alcohol wipe, and I did wipe down this entire bedside table so that I can use that for my sterile, as part of my sterile field, or to place my sterile field, I should say. I'm going to go ahead and open this because it's got my sterile gloves in there and also has my mask for my patient. So we're going to put that on here. And then we're going to go ahead and start to open that. Not touching anything on the inside. I would be masked as well. Give my patient their mask. If we didn't have one for them or they chose not to wear one, then they need to make sure they are turning their head to the opposite direction to make sure that they don't cough or breathe on that port, because odds are this patient is immunocompromised, and we don't want to put them at more risk for infection if they were to cough or breathe on this port while we are accessing it. And then I would grab out my sterile gloves and grabbing corners, keeping my field sterile. And I would take my bio patch and throw that in my sterile field as well. I'm going to palpate the area here. Again, we already assessed the site, but we want to palpate that to make sure we know exactly where that port is, so that we can guide the needle in appropriately. And then the next thing that we should do is we need to prepare our Huber needle. So we would pull that open just a little bit, and I would take one of my flushes, and I'm going to go ahead and connect that using aseptic technique here, or sterile technique, I should more so say, because everything is sterile in there. And then I'm going to go ahead and get all the air out of here, making sure that that is primed, and keeping it in its packaging. Set that off to the side. Think, John, think. All right, so then our sterile field is prepared. We're good to go there. Got our bio patch in there, and everything should be good to go. So before we get started, we need to apply our sterile gloves. I'm gonna go ahead and stand up for this too, for the rest of this. And then go ahead and get our hands in these sterile gloves, as so. And then the first thing I'm going to do is grab out my ChloraPrep, and we are going to want to clean the skin. We're going over the port here, and we're going to do that first in a horizontal pattern. So we're going to do that for 30 seconds. Once we've done that for a full 30 seconds, then we're going to go ahead and switch angles and start doing that vertically for, again, 30 seconds. And then once that's done for 30 seconds, we're going to do it for another 30 seconds, but in a circular pattern, starting from the inside, working our way out. Doing again that for another 30 seconds. And once we get that done, then we need to let this dry. We're going to let that dry for, again, 30 seconds. So while we're letting that dry, then we can go ahead and get our Huber needle ready. So I'm going to go ahead and use my non-dominant hand to pick that syringe up. And shake this out of the sterile packaging here, using my sterile hand to go ahead and grab that needle. And pull the cap off. All right, maintaining sterility, I'm just going to use my non-dominant hand, which is now, we're just going to be aseptic, and I'm going to go ahead and hold on to that port and stabilize it, and then go ahead and using a 90-degree angle, we're going to access that port, pushing until we meet resistance. And that's where we know it's hit the back of that port. And then we're going to go ahead and check for placement by going ahead and aspirating back for blood return. And we seem to have had blood return, so that is good. If we didn't have blood return, we'd have the patient move around, move their arms, jump around, and then we would try again to aspirate. And at this point, that is how we access.